Okay, picture this. You're sitting right there in the orthodontist waiting room. You can hear that low, familiar hum of dental tools in the background, and you're watching all these kids walk out, flashing smiles full of brightly colored bands. Now, as a parent, you obviously want the absolute best for your child's smile. But let's be real for a second. You're also sitting there totally stressing about the massive time commitment ahead. Welcome to this explainer. Today, we're pulling back the curtain on pediatric dentistry to give you the definitive, expert-backed guide to orthodontic timelines.
It's the undeniable question repeating in your mind, isn't it? Exactly how long is this going to take? Listen, your anxiety here is completely valid. Getting braces isn't just a financial investment, it's a major lifestyle shift for your entire family. You're about to embark on a journey that involves balancing hectic school schedules, sports practices, highly specialized brushing routines, and, yeah, the heartbreaking reality of officially banning popcorn on family movie nights. Knowing the timeline is absolutely crucial for planning your life.
Okay, let's dive into this. Here's our roadmap for today's explainer. We're going to cover the real braces timeline, Phase 1 versus Phase 2, 7 factors controlling time, a tale of 2 journeys, shortening the treatment time, and finally, life after braces.
All right, kicking things off with Section 1, the real braces timeline. We're looking at the average duration expectation here.
So it's time to address that burning question of averages head on. When parents ask about the average duration for teenage metal braces, the standard medical consensus generally falls right here, 18 to 24 months. But I need to caution you right out of the gate. Treating this 18 to 24-month window as some sort of strict guarantee is a massive pitfall. Actually, scratch that. It's a huge mistake. There is no single magical number, because quite frankly, moving teeth is a highly personalized journey.
As the old medical saying goes, orthodontics is not carpentry, it is biology. You see, teeth aren't just nails hammered into a piece of wood. They are anchored in living, breathing bone tissue. To actually move a tooth, you need a biological cellular response. Cells called osteoclasts have to actively break down the bone on one side of the tooth, while cells called osteoblasts build brand new bone on the other side. This is a complex metabolic process, and it happens at entirely different speeds for every single child.
Moving right along to Section 2, Phase 1 versus Phase 2. Let's decode these treatment windows.
To truly understand how this biology plays out over time, we really need to decode the treatment windows. Pediatric orthodontics is generally divided into 2 main phases, and they have very different goals. Phase 1, which is also known as early interceptive treatment, happens between ages 7 and 10. This phase lasts about 9 to 14 months. The goal here isn't a perfectly straight smile just yet. It's more about correcting severe structural issues while the child's jawbone is still soft and growing. We're talking about expanding jaws or just making room for permanent teeth. Then we have Phase 2, which hits around ages 11 to 13. This is kind of the sweet spot because the jaw is still growing, but most permanent teeth have fully erupted. This comprehensive phase takes anywhere from 12 to 30 months and involves full upper and lower braces, or maybe clear aligners, to guide every single tooth into perfect harmony. Which brings us to Section 3, 7 factors controlling time, or why timelines vary so wildly.
So the crucial point here is understanding why that Phase 2 window can be anywhere from a single year to nearly 3 years. Why might your neighbor's kid finish in 14 months while yours takes over 2 years? Well, here's the breakdown of the controlling factors. First, the severity of the issue. Closing a minor gap? Quick. But fixing a severe underbite takes moving the entire jaw relationship. Second, crowding versus spacing. Severe crowding is a biological puzzle that requires creating space first, which naturally adds months to the clock. Third, the type of braces. Traditional metal braces are oftentimes the absolute fastest for complex cases. Fourth is that biological response we talked about earlier, the sheer speed of bone remodeling. Now, those first 4 are largely out of your hands, but the last 3, patient compliance, oral hygiene and diet, and keeping appointments every 4 to 8 weeks, those are heavily in your control. Eating hard foods can snap wires, and missing appointments means the teeth are literally just sitting idle in your child's mouth, completely prolonging the timeline.
Let's see what that looks like in practice with Section 4, a tale of 2 journeys, a clinical case study. To show you just how incredibly powerful those controllable factors are, let's look at a real-world clinical case study. Meet our 2 13-year-old patients, Emma and Lucas. Both were diagnosed with moderate crowding and a mild overbite. They started treatment on the exact same day, with identical traditional metal braces. Emma was literally a rock star.
She brushed after every meal, wore her rubber bands day and night exactly as instructed, and never broke a single bracket. Her teeth tracked perfectly with the computer models. Lucas, on the other hand, well, he found his braces super annoying. He chewed on ice, he ate hard taco shells, a massive no-no. He ended up breaking 6 brackets over a year, and every broken bracket meant a week of waiting for an emergency appointment, during which his teeth actually regressed. Plus, he constantly forgot to wear his rubber bands.
And this brilliantly illustrates the ultimate timeline hack. Because of Emma's perfect compliance, her braces came off in exactly 18 months, right on schedule. Lucas, he ended up wearing his for 28 months. That is a massive 10-month penalty. That's almost a full extra year in braces, despite starting with the exact same dental condition. So you see, the child's behavior at home is just as critical as the orthodontist's skill in the clinic.
So how do we fix this?
Section 5. Shortening the treatment time. The action plan. Let's get you empowered with an action plan, officially backed by the American Dental Association, so your child doesn't wear braces a single day longer than necessary. Here's your ultimate cheat sheet. First, strict diet. Broken wires immediately halt tooth movement. Your parental tip? Cut apples into tiny pieces and absolutely ban popcorn. I know it's tough, but do it. Second, rubber bands. These provide the essential directional force needed for jaw alignment. Don't leave it up to memory. Set daily phone alarms for your child. Third, perfect hygiene. Healthy, inflammation-free gums allow teeth to shift smoothly. Seriously, invest in a water pick or orthodontic water flosser. It's a real game changer. And fourth, keep those appointments. Teeth only move when active pressure is applied by newly adjusted wires. Always, always schedule your next visit before you even step foot out of the clinic. All right, finally, Section 6. Life after braces, retainers. The final mandatory phase.
So, you follow the cheat sheet, the calendar is marked, and the braces finally come off. Time to celebrate, right? Well, yes, but I have to warn you right now. The journey is not over just because the metal brackets are gone. To understand why retainers are an absolute non-negotiable requirement, you need to understand this one biological concept: elastic memory. The periodontal ligaments that anchor teeth to the bone act kind of like tiny rubber bands. When braces move teeth, those ligaments get stretched out. The second those braces come off, those ligaments desperately try to pull the teeth back to their original crooked positions. This is called orthodontic relapse, and it is the exact reason why a retainer is mandatory if you want to avoid paying for a second round of braces when they're adults. No way do we want that.
Here's the timeline you really need to prepare for. For the first 1 to 6 months, it's full-time wear. We're talking 22+ hours a day. The bone is literally still hardening around the new tooth positions. From 6 to 12 months, you generally transition to nighttime wear only. And beyond that, it is a lifetime commitment of 3 to 5 nights a week, indefinitely, to fight off the natural shifting that just naturally comes with aging.
Now, navigating this entire timeline really doesn't have to be a guessing game, but you absolutely need the right team by your side, and that is exactly where MedReach Golf comes in. You want to partner with a top-tier pediatric orthodontist in Muscat, and MedReach Golf is the premier platform for connecting you directly with dedicated specialists. Their partnered experts utilize the absolute latest 3D imaging to map out the fastest, safest route to your child's perfect smile. You can effortlessly book a consultation via WhatsApp right now through them to get started. So I'll leave you with this final thought. Knowing what you know now about biology, compliance, and elastic memory, are you ready to take control and transform your child's smile efficiently, or will you just leave their dental future completely up to chance? Thank you for joining us on this explainer.